Traditional medicine practitioners are pushing for more inclusion in the treatment and management of Lassa fever and other infectious diseases in the sub-region. At the ECOWAS Lassa Fever International Conference in Abidjan, lead practitioners argued that traditional medicine should be the first line of defense during epidemics. With support from the West Africa Health Organization, a new regulatory guideline is set to be revised, emphasizing strict adherence to ethics, research quality, and documentation standards for traditional medicine practitioners.
As diseases remain a significant threat to human health globally, despite modern medicine's advancements, many communities rely on traditional healing practices to prevent or treat illnesses. These practices encompass a range of methods, including medicinal plants and therapeutic techniques passed down through generations. The second ECOWAS Lassa Fever International Conference in Abidjan highlighted traditional healing advocacy, providing a platform for stakeholders to explore how traditional and community-based health practices can improve health outcomes and inform culturally sensitive epidemic preparedness and response strategies. Pro Vice Chancellor of Pentecost University, Professor Kofi Buzia, says traditional medicine, backed by regulatory standards, holds promise for effective epidemic management.
As we all know, whenever there is an epidemic, the traditional medicine is the first point of call. I mean, they are the people who immediately be contacted for help, in addition to all the other conditions that our people suffer from. But what happens is, often in interventions, we tend to ignore them. I said in my presentation last time that if you want any effective intervention in our health system in the region, you have to engage with the community. And by engaging the community, it means you are bringing on board traditional medicine, because this is what they live with. And hence that the relevance of our being here for this conference. WAHO developed a document which is called Harmonized Policies and Regulatory Framework. It's about 12 years now. So again, in the wisdom of the Director General, he thinks this document needs to be revised. And the document sets in place, code of ethics, what traditional medicine practitioners can do, issues about research, issues about documentation, even the practice itself. This document reflects that.
While some analysts argue that many traditional practices lack extensive clinical trials to establish their efficacy and safety, traditional medicine practitioners are willing to adhere to regulator standards. Director of Traditional and Alternative Medicine at the Ministry of Health, Dr. Anastasia Yirenchi, highlighted the effectiveness of traditional medicine practices, which draw from diverse sources in treating various ailments in the sub-region.
We want to come out with products that will stand the test of time, that will go cross boundaries. And so we will start preparing ourselves, coming up with products for communicable and non-communicable diseases that can cross boundaries. The whole world is looking up to us. Africa is enriched with herbal potential medicines for us for the future.
Marking a groundbreaking moment, the integration of traditional medicine practice into a major conference on Lassa fever and emerging infectious diseases in West Africa signals a new era of collaboration and inclusivity in the region's healthcare landscape.